Our first story today actually comes from India, where Union Health Minister Dr. Harsh Vardhan took charge, I should say, as the new chairman of the World Health Organization's executive board. The WHO's executive board is comprised of 34 members that are each elected to 3-year terms. Now, the reason why we are talking about this is because the executive board for the WHO, really they have one main function, and that is to set the agenda for the World Health Assembly. Now, to tell you a little bit about the World Health Assembly, that is the one time a year, I should say, that all 194 member states of the WHO gather together. And at that assembly, they decide what the priorities for the organization are. They do things like set budgets, elect new leaders. They determine health goals, how they're going to reach those health goals. Now, this last year's World Health Assembly actually just happened a couple of weeks ago. And obviously, as you can imagine, the main topic of conversation was the coronavirus and COVID-19. However, that is not always the case. And these health assemblies are a place where all of the different priorities are brought forth. And we are discussing this because Dr. Vardhan is one of the union ministers, the union health ministers, I should say, in India, that has been a vocal supporter of that country's decision to place prohibitions and ban on the importation of electronic nicotine delivery service systems inside of the country. Now, obviously, there is a lot of different priorities that the WHO is going to bring up at next year's World Health Assembly. It's hard to imagine that all of the topics of COVID-19 and coronavirus is going to just magically go away by next year. However, it is important to note that we will be following the story to see where Dr. Vardhan and the rest of the executive board decide to place priorities, especially as the Conference of Parties that was scheduled for this year has been postponed by an additional year. So please continue to follow VIDA News for the remainder of that story. The next thing that I would like to do is highlight something a little bit more positive. Here at VIDA News, we believe that harm reduction and tobacco harm reduction works when it focuses on 3 things. That is collaboration, that is science-backed evidence, and an avoidance of stigma. And so we want to also take time during these broadcasts to highlight organizations and services that we believe really fit the bill on those 3 things. And one of those comes from a county in the UK called Northampton Shire. Now, Northampton Shire is about 2 hours away from London, just northwest of London. There's about 750,000 people that live there. And that county's council and the public health service attached to it, they obviously do something that a lot of public health counties do across not only the UK, but across the world. And they have a special service that we want to highlight called their Stop Smoking Service. There's a couple of things that they do, including collaboration. They focus very much on the interpersonal relationship of somebody that has made the decision to quit smoking. They have services typically face-to-face, but now they have them telephone-based. But the thing that we really want to focus on are these things called quit kits that they have started to distribute. These are nicotine replacement therapies that go along with the decision to decide to quit smoking. And the reason we are highlighting it is we have found that this conversation around coronavirus has brought up the idea of essential versus non-essential. And the place where a lot of former cigarette smokers and those that use other forms of combustible tobacco, they have gone into these, they don't know whether they can actually get access to the products that they are looking for. Now, Northampton Shire and their Stop Smoking service has decided to not only provide these systems over the telephone, but also to mail these kits out to those that decide to set quit dates with them. Now, the smoking prevalence in the UK is about 14%, but in counties like Northamptonshire, where there's a lot of manual labor, that number actually goes up to about 1/4 of the population of those people that are working in those jobs are actually those that use combustible cigarettes. So we wanted to make sure to highlight that. We saw this come across in a tweet so from Clive Bates, a name that most of you may recognize. But I also want to say that if you see anything like this, If you find a service that is really highlighting the overall benefits of harm reduction, please reach out to us. You can go directly to our website, vida.news. We have a tip line there. You can drop it, or you can just email it to us at hello@vida.news. The next thing that I would like to discuss is a little bit of an update for you. Last week, we talked about Ray Yeates. He is a gentleman that lives in Nova Scotia. He's actually the founder of the Tobacco Harm Reduction Advocates of Canada. And Ray is currently in a battle with an organization called Continuing Care in Nova Scotia. Because of the fact that he uses these alternative nicotine products, he actually was not given placement in an assisted living facility with his partner and soulmate, Ruthie. And he also received information that he may be losing his oxygen support as well, because the government deems these products as an explosion risk. As we mentioned last week, there has been a GoFundMe that has been set up for Ray. We will go ahead and link it below. You can also be able to see that inside of, you can see that in the story that we have at vida.news. Right now, they're just shy of $4,000 of the $10,000 goal. So I want to make sure to be able to pass that along to all of you to support if you feel so led to do so. Now, I would like to, before we get into our cover story, we have a wonderful panel of guests that are waiting in the wings right now. I do want to say, if you appreciate the work that VIDA News is doing, if you like our independent journalism around the world of tobacco harm reduction, I also encourage you to please check out our Patreon. You can go to patreon.com/VIDA News and support us there. There's various levels in which you can do so. I'm not going to turn this into a commercial for our Patreon, but there's exclusive invitations that you can get to Q&As. There's also some swag, some tote bags and coffee mugs, so you can be able to support VIDA News monthly throughout the year. Okay, so as some of you may know, the WHO has, as I mentioned, there are 6 regional offices for the WHO that help sort of give reports and guidance to each of the member states depending on the region. Because obviously, as you know, different health priorities affect different parts of the world. Now, obviously, we talk about tobacco harm reduction on this program and on the different programs that we have here at VIDA News. And this week, actually on Monday, the European Regional Office for the WHO published a report called the Electronic Nicotine and Non-Nicotine Delivery Systems Brief. And in that, there was some very familiar language that if you have followed along with how public health speaks about harm reduction, speaks about tobacco harm reduction in these products, you may have seen that. There was, however, a little bit of a different change of tune from this specific regional office of the WHO. I'm going to give you a quote specifically from that, where they said that non-pregnant adult smokers who completely switch from combustible tobacco cigarettes to the use of unadulterated use and appropriately regulated products alone may reduce their health risks. And this is a little bit of a change of tune, as I mentioned, from what the WHO typically says when it comes to that. So I would love to be able to bring in a panel now to discuss this report and what this may mean for the overall public health community. Our panelists, I'd like to introduce them now. We have Julie Woessner, the president of the governing board of INNCO Sciences at the School of Global Public Health in New York University, and Dr. Raymond Niaura, the interim chair of the Department of Epidemiology and a professor of social and behavioral sciences with Dr. Abrams at the School of Global Public Health at NYU. Thank you so much to all of you for joining me today.
Welcome.
Thank you. So this question I really would like to ask all of you, but Julie, I will start with you. What was your first thoughts when you saw this report that was published on Monday?
It could have been worse. It could have been much better. It is a very small step in the right direction, is kind of the way I'm looking at it, to be honest. There's a whole lot of may and might and a whole lot of unsubstantiated repetition of stuff that really is not scientifically based. So, but it could have been worse.
Yes, definitely. Dr. Niaura, you have obviously spent your career researching and studying this. You know, you have added multiple publications and research reports to this topic. What were your thoughts when you saw it?
And that whoever put out that statement will get punished by the higher ups in WHO. And I'm kind of half joking about that, but it is a really it's a change in tone for them. So I hope they mean it. But I guess time will tell, and we'll have to see.
Yeah. Dr. Abrams, do you agree with the rest of your panelists?
Yes, I think it's about time, and it's frankly too little too late, and much more needs to be done. The evidence and the science has accumulated so powerfully, especially in the last 5 years, that nicotine vaping is substantially less harmful than smoking. And for many, many smokers who are just unable or frankly don't want to stop using nicotine but don't want to die from the smoke, this is a very encouraging statement in the right direction, because our ultimate goal is to save smokers' lives from the debilitating diseases that come from burning the tobacco in smoke, not from the much less harmful vape. So it's encouraging, but doesn't go far enough.
Now, Julie, you obviously the work that you do with INNCO and the consumer organizations, they've obviously been pushing for things like this. How do you see this specific report coming out of the European office sort of comparing to the overall language that the WHO has had in the past, and how are these organizations, outside of the United States in particular, sort of taking this news?
I think there's some cautious optimism. Certainly the European regional office is in a different situation. They're largely operating under the TPD. So there is some regulation, there is the presence of electronic cigarettes, and so they're able to see, I think, the health benefits. In other countries, we've got outright bans and such. So, the hope is that this cautious optimism that we're getting from the report will filter out through other regions and certainly up to the higher levels of the WHO, but that's just not at all clear, what's going to happen from there.
Yeah. And Dr. Abrams or Dr. Niaura, I would love if you can, you mentioned a little bit about how this does not go quite far enough. Can you sort of speak to some of the research that you have seen? This report does mention some, they mention that there's less health risks. However, they definitely stop short of saying that this can be used as an opportunity, or these products can be used to be able to quit, or in the, helping somebody quit. Can you sort of speak to the research that you have seen or participated in that does show that can be the case?
Yeah, I'm happy to take the first pass on this. So, the party line has been that, these products theoretically could be safer than smoking cigarettes, but it hasn't been proven, and it would take 30 or 40 or 50 years of study to demonstrate this, and so therefore we can't take the risk. But in fact, we know at this point we know an awful lot about these products. Now, not all the products are the same, and some are probably safer than others. But in terms of well manufactured, well regulated products, we have pretty strong biological data showing that all the biomarkers of risk associated with smoking tobacco, burning tobacco, are dramatically, and I mean dramatically, reduced when people switch from smoking to using reduced risk products, e-cigarettes in particular. So I mean that, and this is a consistent finding. and I'm not talking about the animal studies, which have their own set of problems, but if we look at human biological studies, it's the evidence is, in my opinion, at least, pretty overwhelming, that we're seeing, dramatic reductions in these biomarkers of risk. So that in and of itself tells me that, that there's the safety profile has to be looking pretty good. Now, yes, we do need, ongoing research, and of course, and we need to keep, monitoring these things. But I think we're off to a good start. What's surprising to me is that people, selectively ignore this growing body of literature, suggesting that these products are, at least in terms of biological potential, pretty safe. And it's hard to imagine what it would take to convince skeptics, but the evidence is there if you want to look for it.
Dr. Abrams, I would love to ask you a question in particular. When we look at this scientific, we look at the data, we look at the research reports. There is, I didn't really notice anything in this brief speaking at all about stigma, about how maybe somebody being labeled as a smoker has could have negative effects over the course of somebody's life. Can you speak a little bit about that, and when it comes to an overall, sort of the helping somebody stop smoking who wants to stop smoking? At what point does that come in more than just the products themselves?
As a clinician who's actually helped smokers to switch or quit, and also dealt with other stigmatized behaviors like mental illness or substance abuse, we have known now for years that stigma is the major barrier that prevents some people from coming to get the help they need, or people thinking there's something inherently wrong with them if they can't have the willpower to stop smoking. And they get down on themselves, and they have a very negative self-image, which is uncalled for and completely sad. Because the truth is that, we're all humans, and we all have our strengths and weaknesses. And that stigma, I think, both prevents smokers from getting to a point where they might say, well, I might need nicotine for the rest of my life, but I don't have to smoke cigarettes to get it. So this extreme of all or nothing, you have to quit everything to stop this, quote, addiction to nicotine, is also a big barrier to people getting to be able to substitute a much cleaner and better form of nicotine delivery that may be beneficial to them. And yet they label themselves as, having weak willpower or something wrong with them. So it prevents both harm reduction of saying, well, I would ideally like to not use anything at all, but, I'd much rather use a less harmful product than a much more harmful product like smoking. All of that ties into stigma and becomes a major barrier to saving their own lives, being there for their loved ones and family for many more years with better quality of life, saving a lot of money. And frankly, that then ladders up to 1 billion lives lost unnecessarily in the whole world in the next century if we don't remove the stigma and help people who don't want to quit to switch to less harmful products. It's so common sense and obvious. But that stigma can be a major barrier to people getting to a point where they feel comfortable using nicotine without smoke, or trying to come for help because it's hard to admit that they can't do this alone.
This may be a little bit of a elementary question, but if we do have that, if we do have that research out there, like really showing what that stigma can do, for an organization like the WHO, what do you think the disconnect is there, but with not embracing that research and instead going on, more of a prohibitionist or sort of quit or die stance?
they do pay attention to harm reduction issues and have made statements in favor of harm reduction in other areas with respect to injection drug use and sexual activity and so forth. But yet there's very little, evidence of kind of a similar compassionate perspective and approach when it comes to tobacco. And it's hard to explain that disconnect. It's kind of like, they've got it right in certain ways and then completely wrong in with respect to tobacco. And how do we explain that? How do we deal with it? Go ahead, David.
I agree, and I think there's always been a resistance to harm reduction traditionally and historically until it's shown to save many, many lives. I mean, there was opposition to things like needle sharing or ways to reduce, deaths due to opioid overdoses until it was shown that actually, not only this saves lives, but it provides a certain amount of respect for a human being who might not be doing the things you would have to be treated like a human being. And I think WHO has lost its compass with respect to smoking alone, as opposed to the harm reduction that they do with things like condom use and prevention of HIV/AIDS, as Ray was saying. And it is puzzling and troubling. And I think some of it is that they have been unduly and strongly influenced by a narrative coming from essentially a group that was formed when we didn't have alternative products, where it was pretty clear that, in fact, all you could do was smoke. And if you smoked, you couldn't separate the nicotine from the lethal smoke, and therefore prohibition seemed to be an okay thing to recommend for, quote, tobacco control, which really meant smoking control. But now that we have a variety of products, I think they've been very slow to see the science, and there is a group of people that are well-funded and have very loud and credible voices that have continued to push a prohibition stance against smoking when it didn't work for alcohol, and harm reduction is clearly the way to go in many areas. So, I wish the WHO would step back and look at the whole science, not selectively exaggerate some science and omit other science to promote an ideological prohibitionist message.
Yes. And Julie, I would love if you can, you obviously have, an experience working right on the ground with, the consumers that are using these products. And, we've heard some of those stories. I would love if you can just share a little bit, sort of speaking to the points that we have about stigma with the consumers of these products.
I think stigma is, as David said, just a huge barrier to people getting the help that they need to improve their lives and their health. But, another issue that we've got in addition to stigma is misinformation. And we've got a lot of people out there who actually believe that using electronic cigarettes is more dangerous than smoking. At least as dangerous, if not more dangerous. And, this is misinformation that's being perpetuated, not simply by the media, but also by some trusted organizations. And I don't know whether it's by design or carelessness, but, if people don't understand that there are alternatives, if they are stigmatized so that they don't even try, it's a huge public health disaster, and it's a failure. And people's lives are on the line. I think sometimes the people at these high rarefied levels are looking at numbers and policies, and they kind of forget that behind all of that are real people with real lives and real stories. And we don't forget. We don't forget that. And we believe that consumers should be considered stakeholders in this whole arena. And traditionally, we have not been. So, but in any event, I agree that stigmatization is a terrible barrier, terrible thing, and the misinformation.
Yes. Dr. Niaura, I wanted to ask you a question. Right at the top, you know, as you said, half joking that somebody may get in trouble for this. So, with your experience of sort of seeing how the WHO works, seeing how, this research specifically in this topic, do you think that this could be a sign of, maybe the overall organization taking some, diving further down this road, or do you think that we might have more of the status quo?
It's hard to say. I mean, this is again a positive indication, but the track record so far with respect to tobacco harm reduction has not been good, and it gets back to the issue that Julie raised about misinformation. Yes, a lot of it is probably not necessarily intentional, but a lot of it is intentional. And unfortunately, it comes in various nefarious forms. I mean, it's one thing to sort of say, oh, these products are bad for you. They're worse than cigarettes, which is ludicrous. But when you actually have groups of scientists or individual scientists who basically sometimes commit fraud, or more charitably twist evidence and data in favor of the hypothesis that these products are worse than cigarettes, that's a real problem. And people, yes, at other levels, at higher levels, don't have the capacity, the wherewithal, the expertise to be able to sort through the truth from the falsehoods. And this is a real, ongoing problem that, scientists in this space, in this area, are having to contend with, and it's very troubling. And it takes an awful lot of work and effort to push back against, the scientific, fraud and misconduct that unfortunately we're encountering all the time.
So I guess the question that I would like to pose to all of you is, for our viewers out there, what can they sort of do to help wade through this misinformation, the funding sources that we have. We're not sure exactly where they're coming from, or we have an idea where they're coming from, that are spinning certain narratives. What would you suggest for somebody who's just watching this? How can they be better informed and then pass that information on to their loved ones?
Well, the question is what are the trusted sources of information? And typically, we rely on our governments, our government agencies, which generally speaking have served us pretty well. Here in the US, we have, the Centers for Disease Control, the National Institutes of Health, the Food and Drug Administration. So normally I would say, these are the sources that we need to consult. But even then we still run into trouble because there's so much, interference happening. So it's a real quandary. I think, my general rule of thumb nowadays is to tell people not necessarily believe everything on the first pass, but to look for consistency of information, to look at corroboration. If you find that there are, vastly opposing differences of opinion on the topic, that should be a red flag that, you need to do more research, and you need to, ask the questions. What's going on here? Why am I not getting a consistent story? There's always going to be, legitimate questions, things that we don't know about. But then there are things that we do know about, and we should always, seek out trusted sources it's a, you know, and these days, I mean, the world has gone crazy with, you know, information technology, social media. It's harder than ever to sort through the wheat from the chaff. I don't know if that's a good answer to your question, but you know, it's just people have to really be vigilant and talk about these things. Be transparent. You know, transparent about what you know, what you don't know. Transparent about your support, your funding sources. You know, all of that needs to be put out front so that people can at least have an honest conversation about these issues.
Yes, that actually leads right well into. Oh yes, please, Dr. Abrams.
So just try to be quick, but consider the source, and I would also add to that: be really careful here, because the common wisdom is that if you don't like the message, shoot the messenger. And often that's been, oh, there's some funding from the tobacco industry or the so-called evil big tobacco companies. Now, sometimes that's true, and you should take with a grain of salt some of the either research or other things. However, I think it's equally now plausible that the source of funding and the source of information may be biased into being anti-harm reduction, anti-vaping, and be as extreme and as lucrative in getting the money to give a prohibition message. So consider the source could also be, are there biases when you see extreme statements from anti-harm reductionists where you know the science just doesn't support what they're saying? So I would be skeptical on all sides, not just make it easy to say, oh, that's coming from the tobacco industry, automatically it's got to be bad. And so that's one other thing. But also I'd like to say, don't trust isolated extreme papers, and be really careful. I think there are some very responsible synthesis of all the bodies of knowledge by very respectable organizations. And I would name three. One is Public Health England, that has done the most comprehensive, objective, strongest science method reviews and updates its work almost every year. And I have not seen a more strong and rigorous approach to what we know and honestly what we don't know. So I would trust Public Health England across the world as having the biggest synthesis of all the information in an accurate manner, in my opinion. Then there's the Royal College of Physicians, which is equally prestigious and has been around for 400 years to be sure that science is done right. The American National Academy of Science, Engineering, and Medicine is another body that if you read carefully their actual report, not the executive summary and the spin of that summary in the media, but the original reviews of each chapter, they basically say the evidence is strongest, the strongest level of evidence, that e-cigarettes are substantially less harmful than cigarettes overall, and that they can help adult smokers quit. And they never ever say that it's a massive gateway to smoking among teens either. They simply say there's an association between ever using an e-cigarette and ever using a cigarette, or one in the last 30 days. There is no evidence at all that they state, or Public Health England, that there's a massive gateway from e-cigarettes to regular daily smoking. So if you look at the actual data, it's really solid, and it comes from 3 trusted sources. An example, there was a big set of news media that e-cigarettes cause more heart attacks than cigarettes. And I don't know if anybody noticed, but in the last 2 months, that study was retracted by the Journal of the American Heart Association as being unreliable. In fact, they counted heart attacks that occurred before the people started using e-cigarettes. And yet that is being used around the world to say e-cigarettes are as harmful or more harmful than cigarettes without noticing that that study has been retracted. So again, I agree with Ray, but I would say there are trusted sources, and they tend to be comprehensive reviews by august bodies, not isolated studies.
It's wonderful. You actually answered the question before I could ask it. We had a question from YouTube that was asking about, different sources that, can point to what, the message that you all are sharing. And, specifically about that, retracted study, we did cover that. That was one of the first stories that we covered with our most recent section of tobacco harm reduction updates here with VIDA News. So I appreciate that. I could be able to speak with you three all day. We could do this for hours. However, I do want to, keep this broadcast close. I hope to be able to have you all on again soon. But I do want to give each of you just an opportunity. Obviously we do have, there's a lot of news and a lot of buzz around things like World No Tobacco Day, which is coming up, which, as we've had in this conversation, some of that compass, that North Star, has been lost, and it seems to be shifting more to prohibition of these devices rather than, for the issues that we have discussed. So, I would love to just give each of you just a moment if there's anything else that you would like to be able to share with our audience as any parting thoughts for any of these topics. And Julie, I think we can start with you.
So May 31st is World No Tobacco Day, but more importantly for tobacco harm reduction advocates, May 30th is World Vape Day. And there's actually a website, worldvapeday.org, and consumer organizations from across the globe have joined together, and we're going to be sharing our success stories and sharing positive messaging surrounding the use of vaping as a tobacco harm reduction alternative. And, it's very important that vapers participate, and there are instructions on how to do it at World Vape Day. But, I think the one thing I would like to say in parting is, the discussion about trusted sources, a related point to that is the erosion now of public trust among certainly the active vaping community in sources that we should be able to trust. And because they have gotten it so very, very badly wrong on a subject that we as consumers are quite expert on, it leads people to question their judgment in other things, which is very unfortunate because I don't think that they get everything wrong. I think they're quite right on some issues. And, so there's a real cost to these credible organizations that aren't playing fair with vapor products. And the cost is people just won't trust them for anything. And that is a huge cost. Thank you.
Dr. Niaura?
So, we've all heard the saying, if something's too good to be true, it probably isn't true. Well, the corollary to that, if something is too bad to be true, it also probably isn't true. And I'd just like to emphasize that nobody has a monopoly on the truth, including scientists, including government bodies and government officials and non-government organizations like the World Health Organization. So, be skeptical, ask questions, persist until you are satisfied that you're getting to the bottom of things. Don't accept anything at face value, especially in this area. I know that's hard, but we've got to move ahead, and the only way to do that is if we're transparent with our knowledge and our lack of knowledge and open with our questions.
Thank you. Dr. Abrams.
So I would say context is everything. And if messages are displayed out of context, that's how propaganda and misinformation is conveyed. And there are two ways that that's done. Errors of omission, where you don't say the whole story, but you don't completely lie. There's a particle of truth. And errors of commission, where you massively exaggerate a real harm, which is also not a lie, but makes it far worse than it is. So I would watch out for both of those in everything that you read and look at. The biggest omission is to not directly compare a nicotine or vape product with toxic tobacco smoke. So for example, you will see someone say, you know, vapes has chemicals in the aerosol and the flavor, and therefore it's not harmless. It's got some things in it that are not good for you. They'll stop there. And that leads many consumers to say, well, it must be as harmless as toxic tobacco smoke. They don't add, but those toxins are at trace levels, and most of them won't cause human harm, and it's 98% or 92% or 95% less harmful than cigarettes. So you should always look at a statement that compares the relative harm of the product with the toxic smoke and harm of a cigarette, not compare it with just nothing, or leave out the comparison with the cigarette. And the exaggeration is obvious and comes from the omission, which is you can then exaggerate the harm, let's say of vaping. And the bottom line here is the biggest myth of all that needs to be corrected is that nicotine is not the source of harm, either heart disease or pulmonary disease. It's not harmless, obviously, it's a chemical, but it is not the primary source of harm. Nicotine doesn't cause cancer. It's the toxic smoke and at least 69 carcinogenic chemicals in the burnt smoke that cause the cancer. So those two things alone, it's almost common sense. If you don't burn it, how could it be as harmful as heating it, warming it, and inhaling it? So relative harm relative to cigarettes, and watch out for errors of omission, not saying the whole story, and commission, exaggerating the small harms that you do want to exaggerate. All of that leads to prohibition out of context.
Yes, context is key. Thank you again to our panelists, Julie Woessner, Dr. Raymond Niaura, Dr. David Abrams. Thank you so much. I look forward to having you all on the broadcast again very soon. Okay, that is just about all that we have for our broadcast today. Thank you so much. Don't forget to please follow us on all of the social platforms. You can find us at vida.news on Facebook, Twitter, Instagram. We are on YouTube. We are on LinkedIn. Basically, wherever you are on the internet, you can be able to find us there. And just as a reminder, the Global Forum on Nicotine has been moved to an online forum. We were going to be right there in Warsaw for that forum to cover it. Obviously, we will not be physically there, but we will be there online. That is coming up in June. We have special coverage. We have special interviews, special guests. We are really going to do all that we can to make sure that you have all of that information, and we break down the information for you. So thank you so much. I look forward to seeing all of you online, and I will talk to you again soon. See you later.